As the intersection of biotechnology and national security becomes increasingly vital, the focus is shifting from addressing today's challenges to proactively shaping tomorrow's solutions. In a world where biological threats evolve alongside opportunities for groundbreaking innovation, IQT stands at the forefront of preparing America and its allies for the bio-driven future. The convergence of advanced biotechnology with other emerging capabilities is poised to redefine how nations secure their health, economic, and defense interests. IQT aims to help the U.S. and our allies cultivate a resilient bioeconomy, reduce dependency on unreliable supply chains, and ensure America's technological leadership as we face unprecedented national security challenges. Welcome to IQT Explains, a series on the IQT podcast exploring cutting-edge global technology trends and their impact on national security. I'm your host, Farid Nemri, and today we're embarking on the final episode of our three-part series on IQT's investments in the bio domain. While previous episodes traced IQT's roots in bio and its recent achievements, today we'll look ahead to the future, exploring how investments in biotech are shaping a safer, more secure, and innovative world. To get things started, I'll introduce today's guests, Dr. Jess Dymond and Dr. Louis Rubinson. Jess is a Vice President of Technology and co-lead of IQT's BNext practice, where she provides technical and strategic leadership in the biotechnology and biosecurity domains. In her prior roles, Dr. Dymond led an active research portfolio at the intersection of life sciences, data science, and engineering, with an emphasis on emerging technology analysis. Jess, thank you so much for joining me today.
Thanks, Farid. It's a pleasure to be here.
Louis is a Vice President of Technical Capabilities at IQT. He was previously a hospital executive at large referral hospitals, including Chief Medical Officer at Morristown Medical Center in New Jersey and Deputy Chief Clinical Officer at University of Maryland Medical Center in Baltimore, where he was also a professor of medicine in the University of Maryland School of Medicine. Louis is a practicing pulmonary and critical care medicine physician with experience in healthcare delivery system engineering, technology innovation for high acuity care, operational medicine, and resuscitation. Louis, thank you for joining us today.
Hey, Farid. It's great to be here.
Fantastic. Thank you both for joining me. We held two conversations with your colleagues on the BNext team to discuss, as I mentioned before, the history and the roots of biotech and our biodomain and investments activities there. And now we're taking a step back to see what does the future look like. So a lot of what we're going to discuss is really not guaranteed, we're not sure of, but it's what we've been tracking and what we imagine for the future as we monitor the current landscape. So I'm very excited about such a futuristic conversation. And I'm excited for us in a few years to look back at it and see how have things evolved. So that's kind of a disclaimer to our listeners of this look-ahead mindset that we have. And I want to start the conversation with you, Jess. Just looking strategically, if we've been hearing a lot about the biorevolution being at an inflection point or at the cusp of a certain revolution in the biodomain, however that may be interpreted, right? When you take a look at that, when you think about currently where we stand and what the future holds for biotech, biocapabilities, and addressing the challenges that lie ahead, but also that currently exist, how do you break that down? What are you excited about? What challenges do you anticipate? And how do you see bio and biotech playing a role in addressing those big challenges that absolutely are very relevant to national security?
Yeah, it's a great question. Thanks. I think one of the things we are thinking about in a huge way really is how to broaden our definition of national security. So you've heard some really fantastic thinking from our colleagues in some of the previous podcasts about some of the near-term opportunities in front of us with biomanufacturing, with the ability to take a biological path forward and really new approaches for things like biomedical devices and the way we're managing and thinking about biological data. I think the potentially transformative impact that biotech and biomedicine can have in the future is very much at the front of our thinking all the time, and broadening our definition of national security to include those the breadth of applications that can be transformed with bio is very important to us. So moving beyond even our traditional definitions of things bio can tackle like health and medicine, agriculture, thinking about things like industrial processing and manufacturing, thinking about things like environmental health, thinking about broader health security. All of these are important definitions that we are beginning to work toward in this future realm. I think as we are considering the opportunity for broader impact, that leads us to think about things like platform technologies that can have really broad impact across a number of different domains. So rather than a single product, perhaps a whole technology platform that can produce a multitude of different products, and that can really be a rising tide that lifts all ships, so to speak. Of course, with that kind of potential, we have to be very cognizant about ways those technologies could be exploited or corrupted as well. And so thinking about stewardship of those technologies and how we are engaging in that debate, where there is opportunity and where we have to guard against risk, is very much part of our thinking as well.
Absolutely. And building on that, Lewis, because expanding the definition when considering bio of national security is certainly pivotal at this point, as Jess explained. But there will always be those foundational realms or suite of technologies or areas that are at the forefront of considerations when it comes to health and biosecurity, infectious disease, global health in general, and public health. As the there's an increasing human encroachment into different natural ecologies. There's, of course, we live in a globalized world. There's increased mobility. As we consider that as a physician yourself, what are some of the challenges but also opportunities to keep our optimistic lens on when it comes to addressing those health challenges? Where do you see those trends going? Are you encouraged or are you more concerned?
Thank you for that question, Farid. I think you really well summarized why there is continuing risk of humans being exposed to new infectious disease. So ecological encroachment leads to the possibility of diseases that usually infect animals to be able to potentially jump species and infect humans. If the right things happen at that point in time, those typically they're viruses can evolve to actually then be able to spread from human to human. So you have this zoonosis, a disease that infects animals, jumps to humans, and ultimately, potentially, if it happens enough, may lead to the possibility to propagate infection within humans. I think the likelihood of modern technology making that not happen at all is quite low. And we have to expect that as there are more and more humans on the planet, that those risks and exposures will continue to happen and may even increase. The upside, though, to this is the tools to potentially mitigate the impact on humans are continuing to evolve. So if we look back to the legacy strategies and investments of IQT on, pre-COVID pandemic preparedness, many of those requirements hold true today and, in fact, continue to really be important requirements. And those are early detection, followed by mitigation strategies, environmental controls, as well as even therapeutic strategies. The excitement comes as all of those have burgeoning capability and possibility as our tools in biology and data and compute capability continue to increase so that we might actually be able to either identify things and develop vaccine much faster than before or other therapies. And even now as we understand the host, the human, in its role with infection, the ability to be able to potentiate the human response so that we have very rapidly available tools. So in summary, I would say that it's likely that, our future is going to continue to hold new outbreaks, but hopefully if we're strategic about applying proper technologies that we will be able to respond much smarter, much faster, and be able to reduce the potential downside impact on humans.
Certainly. I was reading a study the other day about bird flu has been in the news, as people listening now may know, and a study about like how one mutation may make this, human-to-human transmission possible. And it's actually encouraging to see how these studies are actually being run in a more rapid way and predicting what possibilities, exist, leveraging some existing capabilities, some emerging technologies. So just the modeling of things is encouraging to know what may lie ahead. But it's good to get this reality check of, outbreaks will still happen. We just need to be a little bit smarter and faster at how we respond to it. Just building on that, kind of promising yet sobering reality, let's take a few thousand steps kind of all the way up, have a larger view of things. As these outbreaks unfold, the climate is changing. Human activity is playing a big role there. Sustainability continues to be a priority and a big element of national security, of course. As we consider these transnational challenges when it comes to climate change, how to maintain a sustainable planet, and how the U.S. and how IQT assisting our government partners in that realm, can do more. How do we view things? How are you considering the challenges, but also the opportunities and possible emerging technologies that may address such issues? And how is IQT playing a direct role in building a more resilient bioeconomy when thinking about these issues?
It's a big question. And
Indeed
so I think
yes.
if we break it down a little bit, I think there's the question of, what do we need to accomplish with technology in order to address some of these emerging challenges? And we talk about things like a changing climate and supply chain security and, some of the broader aspects we touched on a moment ago. I think understanding how technology can contribute resiliency to the nation is really important, whether that is in terms of infrastructure or agriculture or supply chains. All of these things we approach from a slightly different angle. We do feel that bio in a number of different forms can really play a significant role here as far as providing us alternatives to petrochemical manufacturing, for example. So even if we look at agriculture, production of fertilizer is a major contributor to greenhouse gases every year. This is a place where we can now begin to imagine a future where we are turning waste on farms directly into fertilizers that go right back into the soil in the same place and are promoting growth of crops in that setting, rather than importing agriculture that is contributing to this broader climatic challenge. We can also look at that from a slightly different perspective as well, in terms of creating more robust crops that can be, again, resilient against unpredictable weather patterns, against flooding, high temperatures, low temperatures, and perhaps even emerging infectious disease, where we do see new disease vectors coming in, new types of fungus, for example, or new types of pests that are going to be challenging our crops in the future. Taking a little bit of a turn from that angle, I think infrastructure is something that we often don't think about bio playing a real role, but this is a place where we can be turning to bio for equally robust and resilient solutions to traditional production paths for concrete, for example, or even different kinds of adhesives we've seen in recent years. That bio holds a tremendous promise for giving us a whole new array of tools, a whole new array of building blocks. To get to that future and many others in that same vein, we do have to address the challenges in front of us right now as far as building bioproduction capacity, addressing the scale-up challenge, which often prevents us from being able to move from the bench to the market as easily as we would like, and the pervasive data challenge that really is an issue or a challenge for us across the board as far as not only discovery, but also validation and implementation of a lot of these technologies as well. So there's work to do in front of us, but I think opportunity across the board for bio to have enormous impact.
That's excellent to hear and promising. This reminds me of the reason we pursue these advancements is to increase quality of life for humans and for our citizens. And kind of related, I want to build on that concept of using biotech to increase quality of life and go to you, Louis, as someone who has worked on this and looked into the neurobiological advancement and how biotech can improve quality of life. There are some interesting things currently unfolding in the ecosystem of innovation. But if we look ahead, what advancements do you foresee in neurological research, and especially leveraging the continuously evolving artificial intelligence advancements there that will contribute to quality of life? Are the companies we have been talking to and are investing in pushing those boundaries and crossing those barriers? What's the horizon like when it comes to that? And I know my questions to you both today are very big questions. It's because we're looking at a pretty big timeline here ahead of us.
So up until recently, the brain has really been one of the last frontiers in so many different aspects of biotechnology and biomedical science. When you look where we are now versus a century ago, it's night and day. Many of the things that we do in terms of managing neurologic illness or injury aren't as dissimilar when you look way back when, because we haven't really quite yet been able to forestall neurodegenerative diseases. We haven't been able to restore neurologic function to dead neurons. We're better at some of the acute management as well as the symptom management, as well as some of the diagnostics. But in general, we haven't really been able to hit the brakes on neurologic injury and illness and then even reverse back to restore function, let alone to even potentially enhance function beyond what is normally physiologically possible. With the convergence of compute, the ability to manage large data, better analytic models, better microelectronics, and better material science, I think we are coming on a new frontier that actually may be able to start really changing the paradigm there. And why is that important? A third of the world is impacted by neurologic disease, whether it's dementia, stroke, some neonatal conditions, and a variety of other really devastating conditions. And given that cognitive function is so near and dear to the human condition, it's the greatest source of disability in the world. Mm-hmm. So both from a societal impact strategy, the ability to allow someone to restore memory who's had cognitive decline and dementia would be incredibly important just for that one human, their family, but for society writ large in terms of the person's ability to maintain productive sense, the sense of community. And you could also imagine the companies that really lead in that revolution will be very, very important from an economic standpoint as we move forward. There are investments that we've started to make that are really going beyond some of the more basic elements of restorative function in neurologic injury. Not that those first generation interventions aren't incredibly important for those people, but we have started to see the emergence of companies that are really looking to potentially do things that really seemed like they were out of science fiction. The ability to maybe have more impact for refractory mental health disorders than has been seen from either behavioral therapies or pharmacologic therapies. The ability to restore large amounts of function that are lost due to stroke. The ability to prevent the adverse sequelae of movement disorders like Parkinson's disease. And that really requires a fundamental shift from basic microelectronics in the brain to novel ways of trying to both read and write to the brain with much greater coverage, with much broader coverage, so getting to deeper structures. And all of this is starting to get in the realm of proof of concept and hopefully will really accelerate to the point of commercial application within the next decade plus. And also just the foundational understanding of the brain is really changing dramatically as well. So it's not just brain-computer interface and devices and other ways of doing neuroenhancement. I really think the number of opportunities are really exciting. And again, this may be similar to the software and hardware revolution that we previously experienced, just because it touches so many people and it has so much impact across so many domains, like we had talked about, both the human experience as well as economic domains and commercial viability.
Definitely. And you mentioned, of course, when we were thinking about let's say brain-computer interfaces and such technologies, the advancements in semiconductors and microelectronics are crucial there. And we recently published a podcast with some of our colleagues in that industry talking about the state of the art there, where the realm and discipline is going and how we envision it. So for our listeners, if you want to learn more about advancements in microelectronics, please check out that podcast to see IQTEL's approach and thesis there. So talking...
If I can pull on one more thread related to that, an excellent plug, Farid. But when we approach neurotechnology at IQTEL, we're in a very lucky space that we have a deep level of expertise and understanding across a variety of domains, which really is necessary to be able to evaluate what is the state of the possible and what is a bit of snake oil. Because the promises are so dramatic, you really need expertise in AI and data. You need expertise in microelectronics, you need expertise in material science, and you need expertise in clinical science to really understand how all of these kind of come together to does this potential actually really make sense and stand muster. And then the other thing we do is we leverage the expertise of our investment group to be able to understand, is this the right leadership team in a company that's going to have to navigate a long timeline and a variety of hurdles to be able to get both regulatory approvals as well as to really focus down on the requirements that they're trying to solve. So this is absolutely a team sport as we're looking to the future to be able to evaluate this. And I think, again, IQTEL is one of the places that's uniquely positioned to be able to do that kind of evaluation and kick the tires.
Absolutely. I mean, you actually gave me a good segue for what I want us to conclude this, futuristic, strategic conversation with, which is, as you mentioned, even our composition at IQTEL is very cross-functional and interdisciplinary because it's needed. And that's what we're seeing unfold now. It's that convergence of technologies. It's no longer just, like a biotech purely so. It's leveraging AI, leveraging other advanced technologies to enable certain biotechnologies. So as we witness such convergence, as we see those disciplines kind of intersect even more and more, how do you envision the this intersection and this nexus redefining national security going forward, and specifically when it comes to the U.S. technological leadership? I mean, this is something we're continuously thinking about here at IQT, but looking at the next few decades. Just I'll start with you about this again with my tough questions. What do you envision there?
So I think, again, big question that we can take from a couple of different angles. One being from the technical disciplines that we need to be pulling together in order to achieve these big goals. I think Lewis mentioned the foundational knowledge of the brain that is changing the way we're thinking about moving some of the neurotech forward, and how that is transitioned into or implemented in these technologies is a really critical component that requires much, much more than just foundational understanding of brain biology, for example. So across the biodomain, we see technologists from many, many different spaces working with engineers, working with process optimization engineers, working with environmental engineers, working with commercialization folks, working with production folks, all of whom need to come together in order to turn either foundational knowledge into an idea, into a product, and that product into something that actually can be implemented out in the world. The example of agriculture we gave earlier is so seemingly straightforward until we stop to think about what that actually requires when we go from this idea of making a new molecule to being able to scale that up on site, to being able to implement that into existing workflows with existing infrastructure. These are not trivial things, and being able to pull together the right team to be able to make that a reality is really critical. So one of the things we're increasingly excited about is finding companies that do pull together these holistic teams, often that are very reflective of the kinds of teams we build here within IQT that represent all of these different technical disciplines and different perspectives of the world, that are able to go across that full spectrum from the most basic or fundamental research all the way through product development. Here, I think we are acutely aware that bio doesn't exist in a vacuum or exist in isolation. We work hand in hand with our colleagues across the board, whether it's in semiconductors or with AI, to really understand all of the components that go into building these technologies. I do think if we choose to leverage that capability well, from a national perspective, this also gives us tremendous possibilities of identifying new problem spaces where these technologies can be applied very meaningfully. So one thing that in the past has been incredibly challenging in siloed R&D environments, for example, is taking a technology and looking for every problem that technology can solve. And instead, if we really start from a problem-first perspective, what are those most critical challenges in front of us now as a nation, as a world, that we need to be addressing? What are the right tools that we can be building, pulling all of these different capabilities together in order to address that challenge? This shift in thinking is inherently an interdisciplinary problem space where we have to pull together those cross-disciplinary teams to be able to tackle them meaningfully. So again, I think where we are finding opportunities like this that are great exemplars, this is something we're really looking to highlight moving forward in order to help amplify the importance and begin to really build the discussion around the kinds of impact that can be achieved when we work more broadly than outside of our traditional silos.
Yeah, I would absolutely foot stomp what Jess said, and just probably would add one last component, which we're starting to see great advances, but access remains a challenge, and that's because the multiplier effect, it becomes a problem where cost of these advanced technologies can be out of the reach of many who would benefit and are in need. So part of the kind of rethinking of engineering and redesign also has to be, how do things scale up where a company can still be able to stay in business and generate revenue and continue to evolve and continue to generate more products, but at the same time also make it beneficial for the average person to be able to get access. One example is the excitement of some of the genetic therapies, including recently a genetic therapy for sickle cell anemia. There are 100,000 people in the U.S. with sickle cell anemia, and there's a dramatic impact of sickle cell disease in Africa. The current cost of these therapies are in the millions of dollars. And that cost is prohibitive. So as we continue to forge ahead, not that this iterative step is not incredibly important and exciting, just as important at being able to cure a disease is making sure that a person with that disease can actually access that cure to benefit from them, rather than just a few, I think is also part of the future of this kind of multidisciplinary team that we're going to see, and people championing not only scientific advance, but also advance for society. And I think that's a key part of the algebra that we're going to continue to see as startups continue to make great changes for the world.
Can I add one point there? Because I think this is a place where we do see pretty profound creativity and almost paradigm-shifting technologies. I don't think that's too strong a statement, but I think it's not enough to do it faster, better, stronger, right? Mm-hmm. We can't scale capabilities or medicines that cost millions of dollars. It just simply isn't a sustainable option. And we see the same thing in the biotech space as well. That green premium really only holds for a little while. And once the incentives are gone, once the novelty perhaps is gone, the consumer base is waning. This is not a business plan that's going to carry companies through. And so this is bringing us all the way full circle to the earlier part of the discussion where we're seeing platform technologies that really are profoundly changing the way these things are being made. In the previous podcast, our colleagues mentioned Prolific, which is a company using light to build food and to build medicine. This is a total reimagining of the way that we've done these things before. And those kinds of step changes, again, don't happen in isolation. So it really is thinking about the full process from that idea to the product and the teams that have to come together every step of the way in order to make those things achievable. But I think platforms that are paradigm changing are really at the front of our thinking as we are looking forward to the future of the practice.
And these enabling platforms, I think, can really be flywheels. One company that we have an investment in Neurotechnology, along their pathway to develop their own very innovative vertical stack was also then to take those components and make them available to the broader community to reduce the cost of entry for a variety of other commercial entities as well as high-impact research groups so that ultimately all ships will rise from really a community of innovation rather than just building, an IP moat around that and hoping that, one winner takes all. So as we look to future companies, that's an additional kind of part of our assessment of really are they creating overall a community environment that can enhance others to be able to play well. It's not trying to be Pollyannish and expecting a socialist approach from startups, but we do see companies that are building on that I believe will be very promising and potentially accelerate innovation at orders of magnitude faster than if it's everyone for themselves.
Absolutely. I mean, as the two of you are talking about this, I'm thinking about 3 C's, how to maintain that competition, the healthy competition, the convergence, that inter-industry, interdiscipline, convergence of things, but also cooperation. So continuing to work together to maintain that competitive edge for the U.S. and our allies. What a promising and encouraging note to conclude on. I could keep doing this with the two of you for hours and hours. Thank you for joining me today. I hope our listeners are leaving with some good insights and some hope for the future and what that entails in addressing sustainability and climate change issues, quality of life changes. So I'm certainly leaving more hopeful, and I hope our listeners do too. Thank you for tuning in to today's episode of IQT Explains on the IQT podcast. Please make sure to subscribe to the IQT podcast so you do not miss out on future content, and leave us a review or comment to let us know what you think or what content you'd be interested to see us cover on future podcasts. I also encourage you to check out the IQT website, www.iqt.org, to explore more content and learn about IQT's global investment platform that accelerates the introduction of groundbreaking technologies to enhance the national security and prosperity of America and its allies.